Hi, my name is Dr. Ronak Patel, and I'm a board-certified orthopedic surgeon specializing in joint preservation and complex knee injuries. Today, I'd like to talk to you about ACL graft choice. So, ACL reconstructions are fairly common in the United States, most commonly in our younger athletic population between the ages of 13 through 20, but also can happen at any age due to traumatic injury of the knee. The ACL is one of the most important rotary stabilizers of the knee, and it's a ligament that connects the femur to the tibia, also from the thigh to the shin bone. So when an ACL injury occurs, you may end up needing ACL reconstruction surgery. Historically, there are 4 graft options for a ACL reconstruction. One being a cadaver graft. Typically, the cadaver graft or an allograft is reserved for older patients over the age of 40. We also will use and recommend a cadaver graft in situations where multiple ligaments are injured, including what we call a multiligamentous knee injury or a knee dislocation, in which the ACL, the PCL, the LCL, or the MCL are torn together. We typically do not recommend allograft or cadaveric grafts for patients under the age of 40 unless it is a revision surgery and other graft options no longer are available. The next 3 graft options are autograft or graft options from that patient's own leg. The first graft option is the patellar tendon, also known as a BTB for bone tendon bone. This graft option has been around the longest. It's tried and tested, and it is a great graft option for patients who are looking to get back to cutting and pivoting sports. The patellar tendon is tried and tested, like I mentioned before, but does come with the downside of statistically significant chance of kneeling pain. So pain when you kneel on that knee, and that's because you take a part of the kneecap bone as a part of the graft. The second graft option is the hamstring tendon, and the hamstring tendon has been around for a little bit less than the patellar tendon, about 20 to 30 years, and it is a good graft option, but it is an all soft tissue graft option. So subsequently, you don't always know the size of the hamstring diameter you're going to be getting. We want to make sure you have a nice thick hamstring graft, and ultimately the downside of a hamstring graft is that you'll have a little weakness in the hamstrings for the first 12 weeks. You should not have any long-term clinical weakness in the hamstring after a harvest of the hamstring autograft. One other thing to be mindful of, recent literature has proven that a hamstring may not be the most ideal graft in a young cutting pivoting athlete. And if the hamstring is chosen in a young cutting pivoting athlete, then it should be augmented with an LET or a lateral extra-articular tenodesis procedure to help minimize failure rates. The next graft option, and the third most sort of common graft option from an autograft standpoint, is the quadriceps tendon. The quadriceps has been around a little less than the other 2 autograft options, more recently in the last 10 or so years, but it is a good graft from a standpoint of having a lot of collagen and a lot of diameter to the graft. One of the downsides of the quadriceps graft, however, is a bit of quad weakness post-surgically that can take 12 or so weeks to recover in terms of clinical strength after harvesting quadriceps tissue. It is worth noting that there's more and more literature coming out on the quadriceps graft, and there may be a higher predilection for arthrofibrosis or stiffness after this type of graft option. However, certain graft options are more amenable in younger skeletally immature patients. So if you're still growing and your growth plates are open, we typically don't recommend the patellar tendon because it can potentially fuse the growth plates. So a lot of factors go into graft option selection when it comes to ACL reconstruction, and in my belief, and based on the literature and the research supporting ACL graft options, it should be an individualized choice. So that discussion between me or a surgeon and the patient is an individualized decision based on that patient's age, characteristics, and any other factors that may be involved in picking the right graft for that patient. I certainly do not recommend a one-size-fits-all treatment strategy when it comes to graft selection and ACL reconstruction surgery. Please feel free to come visit us if you have any questions, or look at some of our other videos when it comes to LET and ACL surgery. Thank you.